All right, good morning, everybody. Nikki Burnett here. Today's Taste Life Nutrition Radio podcast streaming live on kuhsdenver.com, where we have Dr. Mitchell Yass on with us today, talking about chronic pain. And I believe we're going to be talking about chronic pain in a very different way than you're used to, which is usually the stuff that gets me the most excited, because I like the stuff that we don't often hear about, which is why we do the show. We want to bring to you the truth. We want to bring to you the goodness of all that's out there and the people who are out there making their way and kicking tail at the same time and giving people what they need to heal, to optimize, and to do the best that they're supposed to do in life. And I think this is a super unique and a super unique approach, but it's what's missing in our current healthcare system. So anyway, I will stop there. Thank you. Do you prefer Dr. Mitchell, Dr. Yass? Mitchell, what do you like?
Mitch is good.
Mitch is good. Perfect.
The easiest way.
I like easy. It's my favorite. Awesome. Well, thank you so much for being here. I'm really, really excited to jump into this. We were having some conversations prior to the show starting. And I mean, within just a couple of minutes, we were hitting on these huge things that I'm like, we need to talk about that. We need to talk about that. We need to talk about that. So we're going to dig deep. And we're going to have some fun, and we're probably going to, ruffle a few tail feathers, but that's okay. We want to do that as well. So, but as always, the first thing we do is start the show with gratitude, because gratitude can change the world. It's a big, big freaking deal. So, Mitch, what are you grateful for today?
I'm grateful that God gave me the ability to do what I do and the knowledge and understanding to allow me to provide this method so that people can live without pain and live the lives they justly deserve. And for several years I didn't understand it, and then he made it clear to me, and now I appreciate everything I've gone through, and I look forward to allowing the world to know that anyone and everyone should be pain-free and fully functional. So yeah. I'm obviously extremely grateful for the fact that I can do this.
I love that, and I'm going to piggyback off that, I think, when it comes to what I'm grateful for, because there are so many things that we go through in life that maybe while we're going through it, we don't really understand why. And I think that's, and we talk about this a lot on the show, but it's so important to be able to have that hindsight to say, God had a reason, and he has a reason in everything that he does, right? And so this has been my goal for the year, and my word of the year has been listen. And that's really what I'm trying to do, and try to really just take that step back and know that everything that's happening is God's will, and just take it for that, and then be grateful for it and love all over it, even when it's hard.
So basically, if people can understand, everything is and everything happens because it's his will. Therefore, this is the hard thing for people to accept. There is no good or bad. There simply is.
Yeah.
Now, what happens is, let's say today something happens to me and it feels like it's a bad thing. I lost my job, right? Well, then it turns out that losing that job leads me to do the very thing that I had a passion for,
yeah.
And I have the happiest life in 10 years from now. Was this really a bad thing? Or was it a good thing?
Yeah.
It was simply was.
Yeah.
And that's the key to understand. You don't know what's happening in your life in terms of its relationship to good or bad, simply because you don't know how it's going to affect you in the future. And so the answer is to live every day, simply living and appreciating it for what it is.
I love that so much, and it's so funny because you kind of are, you just told my story, right? So, and I'll be super brief with this, but it is interesting because early on when we moved to Colorado, I had a job and it was going well, and I was making more money than I had ever made, and all of the things, and then they cut me. They just did a massive layoff, and I was like, well, now what am I gonna do? I'd been practicing my own nutrition for years and years and years, but it wasn't me, it wasn't who I was, it wasn't what I did, it was just what I wanted. And then here I am, because of that, because I was laid off, this is where I am. I'm talking with you, I'm talking with people about nutrition and health and wellness and truth and light, right? And all of these things, and doing my best to lead and to guide people into their optimal health. And, again, meeting, people like you. So it's pretty amazing. It is. It's really fascinating. So
I agree.
Cool. Let's do this. Let's talk a little bit about your history, where you come from. I know you've got a good story, and then we'll just dive in from there.
Sure. All right. So I'll start with the idea. I was a 99-pound weakling and had a lot of self-esteem issues. And from 19 to 26, I tried to lift weights, and nothing happened. I did everything Joe Weider and Schwarzenegger said, and nothing would take place. Then God spoke to me. This is one of the times he spoke to me, and he said, well, you have to understand that weightlifting has something to do with physics, because you're pushing against gravity, and gravity is a force vector. So if you can start applying, you took a high school physics course, start applying the laws of physics to weightlifting, and you'll probably do better. So I go into a gym, and I start looking at every exercise and trying to figure out the most appropriate position, all this other stuff. Well, over 4 years, I put 40 pounds of muscle on.
Wow.
At that time, I went from 160 to 200 in 4 years. I was actually doing my first career, which was a project manager in construction. I did it for a couple of years. I did not find any satisfaction in it. It was not fulfilling. So I ended up taking a job in a gym just about this time, and the guy says, oh, you could become a physical therapist, you can work on people's bodies, and you don't have to go to the level of physician. So I said, okay. So I look into that, and I'm able to get into physical therapy school. You're now going to do your last semester is affiliations. Now you're treating people. You have a little badge, it says you're a student, and someone's watching you, and God speaks to me again, and this is the thing that transformed my life. He simply said, ask the person to point to where their pain is. Now, if you were told that you had a herniated disc in the lumbar spine, and your pain was in your butt, your gluteal region, well, that means that herniated disc couldn't cause the pain, because there's no nerve root from the lumbar region that goes to the gluteal region. And I kept doing this. I said to people, where is your pain? The pain isn't where it should be. If the identified structural abnormality was to cause pain, by definition, meaning it can't be the cause. And it keeps happening and happening and happening. And I am literally a student graduating physical therapy school, and I've come to the realization the MRI is baseless. It's finding structural abnormalities that are just independent.
Yeah.
You can find them in as many people without pain as with pain. So I'm going to have to treat these people, and the only thing I knew that was real was the symptom. So I said, let me see if I can interpret the symptom. I should be able to tell what tissue's creating it. And it kept coming back muscle.
Oh, hold on. We lost your audio. Is it? Try again. Yeah, I'm not hearing you. I don't know what happened. Okay, yeah. I don't know, I don't know. He's saying it's you, so I'm not sure what has happened. So you can hear me? Yeah. Yeah, I can't hear you at all. Still nothing? One second. Okay, try again.
Can you hear me now?
Oh, got it. Okay, sorry about that. Sometimes things happen, right? Okay. All right, carry on.
All right, so what happened, what I was saying was that I then started to interpret the symptoms that people were having, and it turns out it was a muscular cause. It was a muscle eliciting that pain. Well, I just taught myself the physics of weightlifting. So I said, what the hell? Let me try and use this method and see if I can strengthen these muscles, and people are getting better in a session or 2 sessions.
Oh, that quickly?
Instantly,
Yeah.
pain-free, fully functional. That was 32 years ago. And over the last 32 years, I have developed the ability to interpret any type of symptom you have and confirm whether it's muscle, bone, or nerve and I have shown that in more than 98% of cases, the cause of pain is muscular, even when structural abnormalities are identified by MRI.
So let's dig into that a little bit. You know, talking about the MRI and what the MRI is doing that is essentially doing us a disservice.
Correct.
Yeah.
100%. So, here's the premise. This is, everyone has to, this is called correlative theory, okay? That's what's used. It's called junk science. It's the worst form of science. This is so scary, but it's true. Now, imagine I have you come to my front door, I open my front door, and the sun rises. And for the next 6 months, I open my front door, and you see the sun rise. I can now say, opening my front door caused the sun to rise.
Mm.
And you would say, holy shit, he's right. I've seen it 6 months now. But clearly that's insane.
Yeah.
Correlative theory says that I'm going to attempt to say that if one thing happens at the time of another, one is causing the other. Now, think about the logic. You always get your MRI when you're in pain, correct? So you're already having your pain. So if I find any structural abnormality anywhere on your body, and that is identified for the first time at the time of your pain, I can assert it to be the cause of your pain. Correct? Great logic, right? So you have back pain. I find you have a herniated disc. That's the cause. You have knee pain. You have a meniscal tear found at that time, right? So all they're doing is they're looking for structural abnormalities. But number one, have they confirmed whether that structural abnormality existed before you had pain? Because if it was there before you had pain, clearly it couldn't be the cause of your pain. So the answer is no. How about the fact that as many people without pain have the same structural abnormalities in the same percentages? 63% of people with knee pain have meniscal tears. 60% of people without knee pain have meniscal tears.
Interesting. And so same with bulging discs. People.
1994, the first study on people without back pain showed 70% of the population have bulging or herniated discs who have no back pain.
Wow.
How about this one?
Fascinating.
Over the age of 60, those that do not have back pain at all, 93% are found to have degenerative disc disease.
No kidding.
Yeah.
Okay. So what you're saying then is these abnormalities are not the cause, it's the muscles. A little Popeye coming out of me. But it's the muscle deficiencies, the muscle weaknesses?
Correct.
Okay.
So I'm going to give you an example. People always do it better with example.
Yep.
If you ask the vast majority of people who have knee pain, they're going to say their pain's around their kneecap. Okay?
Okay.
Now, most people don't realize the knee joint's actually two joints. The joint between the thigh bone and lower leg bone, and then the joint between the kneecap and the thigh bone. Okay? Most people are having pain around the kneecap, the one there, okay? Now, range of motion actually occurs, the ability to bend your knee occurs between the thigh bone and lower leg bone. The ability for you to create the force to allow you to bend your knee occurs at the joint between the kneecap and thigh bone.
Okay.
Okay. So your pain is around your kneecap. That's telling you that the problem isn't structural because you're not having pain at the joint where range of motion occurs between the thigh bone and lower leg bone. It's telling me that there may be, let's say, your quadricep, your front thigh muscle, which attaches to your hamstring. That might have gotten too strong because you're doing everything in front of you, an imbalance develops. When that muscle becomes imbalanced, it shortens and it pulls on your kneecap excessively. So when you bend your knee, your kneecap gets compressed. That's what causes the pain. So you have pain at a joint, but it is the cause is a muscular deficit affecting that joint. Now at the same time, you may have been told you have a meniscal tear, but you see, the meniscal tear is not at the joint where you're having your pain. It's at the joint between the thigh bone and lower leg bone. Okay. So if you're willing to accept that, then you're gonna have no problem with me saying ankle arthritis can cause elbow pain. Does anyone think that's true?
You wouldn't think so.
Right. Well, if that's not true, Who in their right mind should think that a meniscal tear at the joint between the thigh bone and lower leg bone could cause pain at the kneecap? It can't.
Okay.
But you will get that MRI. It will show that meniscal tear, and whatever is shown on the MRI becomes the diagnosis for following treatment. That muscular imbalance between the quads and hamstrings, you see, muscular causes can show up on diagnostic testing.
Right. And so what then happens is people are then got to go to surgery, right? And so
correct. So they'll do their first meniscal surgery and it won't work. And then they'll say, oh, you know what the problem is? There's also arthritis, you're bone on bone, so you need a total knee replacement, and that won't work. And then they'll say, oh, you know what the problem is? The prosthetic isn't fitting exactly right, so let's do a revision. And then they'll say, oh, you know what the problem is? The cement didn't take well, so let's do a revision. And we'll keep doing this. And finally, they'll give up when they see you're frustrated. They'll say, hey, all we can offer you is pain management.
And then here we go with the drugs and
forever.
Yeah.
And you never have function. You never return to normal function. Now just think about how sick what I just said is when all you needed was to come to me. I massaged out your quad, stretched your quad, did some hamstring work, strengthening and maybe glute max strengthening, and you're pain-free and fully functional.
Seems so simple.
So when it's muscular, I basically have a general principle that I look to get 80 to 100% reduction of symptom and return of function by the end of the first session. One session.
Fascinating.
One session. Nobody with me comes here more than 2 or 3 times, and they are pain-free and fully functional with the understanding of how to sustain what I've given them in weeks. Nobody comes. There's no such thing as months of years with the Yass Method, ever.
Well, and that's so beautiful because that's such that's so much of what healthcare has become, good, bad, or indifferent, is the constant, the coming back, and the medicating and the changing, and I'm not guilty of this, right? When I see people, I often need to see them. It's biochemistry, it's not the biomechanics, but I'm seeing people because there's a lot of stuff to work on. But what if there are, that's the beautiful thing about what we're talking about. What if there are better ways of doing this, like what you found? I hope that there are better ways that I can find to help people, in my world. But yeah, that's so amazing that you can just do it in a couple of sessions or a couple of weeks.
The whole essence of this is it's transference of knowledge. If you want to say what's the general perception by what I do, it's transference of knowledge. I have the person come in, I interpret their symptoms. If I identify it, the cause to be muscular, I'm going to do some treatment, teach them exercises. They leave with videos on how to perform the exercises. The goal is for them to then be able to sustain this program so they are pain-free and fully functional. If they choose, they come back 1 or 2 times and we start doing general conditioning to optimize their strength. Optimize their chance of performing activity without symptom and limiting any chance of having a symptom again.
So let's talk a little bit about something like scoliosis. So we talked about this before we started the show. I have a curve in my spine. It's not ever been diagnosed as scoliosis, but it's a 30-degree curve. And what I believe to be the case is, and so you can tell me whatever you think about it, doesn't matter to me, but I believe that over time it's impacted my jaw. I have degeneration in my jaw joint. And so then I've got, I have headache pain. And so all of these things have been managed over time, and I do manage them. But what you're saying, though, is I could correct that curve in my spine, and all of these muscular issues and symptoms that I'm struggling with can be corrected.
So you hit on the thing that basically is the red flag that the medical system is failing royally, is that basically every person at some point or another ends up at the point of wanting to manage their symptoms.
Right.
We talked about the fact that, it's the biggest treatment model used is pain management. They have these spine and pain places opening all over, and it's opioids, or they're doing, which seems insane, the cauterizing of nerves. I mean, it's all just crazy stuff. The back, this is shocking. I'm now hearing people going back and they're giving them Zymbalta before opiates. So I came out in 1993 is when I graduated physical therapy. I was at the beginnings of the real chronic pain epidemic. Before they had opioids, it was all about antidepressants, Zymbalta, and that kind of stuff. Yeah. And it appears they're returning back to that, which is sick. But ultimately, when we talk about scoliosis, the idea that people are told, people are seeking care because they have pain in their lower back. Mm-hmm. They then are told scoliosis is the cause. Mm-hmm. That is lunacy. That is so dumb to make that statement. It's irrational. So every tissue elicits a symptom when that tissue is in distress. What would make a bone go into distress? The answer is fracturing. Mm-hmm. Nobody's saying this person has fracturing of their vertebrae. They're just misaligned. And so I always say, what happened? Is it that the vertebrae, they're having some personal conflict because they're not aligned in the way they should? They're starting to feel bad about themselves, and they're going to try to elicit pain? I mean, it's just psycho, okay? So, basically what happens is you have to understand, bone position is based on the pulls of the muscles that attach to the bone. Mm-hmm. So most bones have more than one muscle attaching. So if we look at your spine, if we say the lumbar spine, the lower spine, we want to look at the fact that the pelvis is the foundation of the body, mm-hmm. and the pelvis must be level to the ground. If that is true, then the attachment to the spine at the sacroiliac will have your spine perpendicular. But if one of your gluteus medius muscles on the sides of your pelvis weaken, you will not have a level pelvis anymore. You're going to have it tilted to one side, and the spine will tilt to the other side. Mm-hmm. Well, no one's going to walk out here, mm-hmm. so they're going to try to find their way back to the midline, and that develops scoliosis. Mm-hmm. Then, as that continues up, because your weight is on one side, gravity is making you have to work harder on one side than the other. Well, that could lead to one of your shoulders getting stronger than the other. Mm. And as a result, now you have the lumbar portion, then you'll end up with the thoracic portion. Mm-hmm. And it's all stemming from one thing, a pelvis that's not level. So all I do is level out the pelvis, and I mean, a couple of weeks at best, you have straight, your lumbar spine is dead perpendicular.
So help me understand something, because it's more out of curiosity, is when you strengthen muscles more on one side, usually means the other side's going to be a little bit weaker. So how is it that you have the ability of either, well, I guess, strengthening the other side so the balance happens in such a short period of time?
So first let me just explain this concept, because this is hard for people to understand. So you see me and you're doing strengthening. Yeah. And they think that's the focus of what we're trying to do with the muscle. Muscles at rest have something called resting tone. There's always a contractile force in muscle. There's an electrical charge on a muscle 24 hours a day. So always remember the idea that every one of your muscles is always pulling. Now, let's say that I have a scoliosis to the right side of my shoulder. So this is my back right here, right? So the convex side always points to the stronger side. Okay. So if I was to muscle test this person, I am going to find out that their left shoulder is weaker. So I'm going to then begin to strengthen just the left side. As I begin to strengthen the left side, the resting tone of the muscles that are attaching to the spine is going to increase. So even when you're sleeping, both sides muscles are going to be pulling on that spine, and when those forces are equal, your spine's perpendicular, straight up and down. So what we're just trying to do is recognize an imbalance develop, which is why your spine is no longer perpendicular. And so we just want to strengthen the weaker side until its force output is equal to the force output of the other side, and their resting tones are equal, and they will pull on the spine equally, and your spine's dead perfect.
So what I was told, I don't think I already said this, but what I was told is that as you age, and I think in my mind I assumed it was more like a, stenosis happening or something like that, but as you age, that really you get to the point where your body just manages, right? And you have there's no, unless you go in surgically, right, there's no way of fixing that curve. Well, what you're saying is it doesn't matter the age, you can fix that curve as long as you address
Correct.
the muscles.
So muscle is one of the unique tissues in the body. It's not affected by age. So I've treated people up to 102, and I got a lady strong at 102. There's an innate contractile force in the muscle. So the thing that really causes aging is loss of elasticity of connective tissue. That's why you see wrinkles. That's why your lung begins to collapse. That's why gastrointestinal. Well, muscle's nothing like that. A loss of elasticity cannot affect muscle because it has innate contractile force in it. So muscle is unaffected by age. I'll say it 1,000 times. Muscle is unaffected by age. Muscle is unaffected by age. I don't care how old you are. You come in here, I'm going to beat the crap out of you. I'm going to make you stronger, and you're going to get your results, guaranteed. I don't care if someone's told you got stenosis or you've had that 6th revision on your knee.
Yeah.
Well, if the problem was that quad is stronger than your hamstring, even after the 6th revision, it's the same thing. So even after all the failed surgeries, I can still get you pain-free and fully functional.
That's so amazing. So give me a story about someone with scoliosis that you've treated.
The worst of the worst case I've ever had
Yeah.
was a lady who had progressive scoliosis over 40 years.
Okay.
She, for the last 10, was on opioids, and basically it stopped working. So she just constantly had back pain.
Mm-hmm.
And so she was told that they're going to put a rod in her spine from her skull to her pelvis. Now realize that's including the thoracic spine, so you're going to be near the heart, the lungs. So they were actually going to have a cardiologist in there to actually shut her heart down while they're doing this. They told her, be prepared, you're going to put 60 pounds of fat on, because the next year you're going to be living on a couch and you're going to have to live off your fat because you are going to have such writhing pain.
Oh my gosh.
From the surgery.
Oh my goodness.
So, through a very bizarre set of circumstances, I meet her, and it's just like what I told you, identical. One hip was higher than the other. She had a bit of an arching as well, so I started strengthening her muscles. Within 2 or 3 months, she was pain-free. Maybe a month or 2 later, she was completely off opioids. And the cool thing was, this is Florida, she lived in Indiana. She was staying with her mother. Her favorite thing to do was slalom water skiing on a single ski. She went back and did it perfectly.
What?
No symptoms, nothing. She went back to do the very thing she loved to do the most.
How cool is that?
And if we had had more time, I assure you, we would have gotten x-rays to show that I was correcting her spine.
Mm-hmm. So are you doing things like that now? Are you taking x-rays and documenting? I'm assuming you are. You're training others now to do your method.
Yeah, so I don't have access to x-rays, but what we are doing are before and after pictures.
Yeah.
So like that 15-year-old kid that I told you about who, in about 2 to 3 weeks, we've taken 40 to 50% of his scoliosis away. Those pictures are undeniable, and his parents are here.
Yeah.
The pictures are undeniable.
Yeah.
I mean, you are literally seeing his back transform.
So, I'm curious about how the method works. So is it adjustments that you're doing, or does that make sense? So is it muscle massage?
There is massage and strengthening. So,
okay.
First of all, the idea of doing an adjustment, again, implies that somehow you can change the position physically of a bone. That's lunacy. The bone position is based on the pulls of muscles. So I don't care who moves what at night when you have your resting tone kicking in. If there was an imbalance, that bone will be out of alignment when you wake up again. It's guaranteed.
Which is why we're always having to get adjusted, because there's still
adjustments for life.
Yeah.
Did they have that in caveman time?
Not as far as I know.
I don't think so. And yet they seem to survive. So.
Yeah.
So here's what happens. A classic example. You got neck pain right here. Classic neck pain. You'll be told you have stenosis, a herniated disc, or a pinched nerve, which is all nonsense. So I'll show you something really cool. All right, your pain is right here. Now, if in fact your symptom was referred from your spine, where would I have to press to bring your symptom on? Here or your spine?
Your spine.
Your spine, right?
Yeah.
So I'm going to press on the cervical level, and we're going to see if it shoots. It's never going to shoot because it's not from there.
Okay.
But if I press here, and I bring on the pain, I just proved to you that your pain is not referred, but point tender, and the tissue I'm pressing on is the tissue eliciting your symptom. That's how you differentiate whether something's referred or not. Okay. Right? Yeah. And what is that muscle right there? It's called the levator scapula. It helps support your neck. So, you gotta be like this all happens because you gotta be like a 4-year-old kid. You gotta just keep saying, why?
Why? Yes.
Why?
Yes.
So why did the levator scapula strain? Well, it turns out the levator scapula attaches to the shoulder blade and then the upper cervical region. And you may have had an imbalance where your chest and your muscles in the front there are too strong for the muscles in the back, and your shoulder came forward. When your shoulder came forward, the distance that muscle has to travel to its attachment point increased. Muscles create their optimal force at an optimal length. If you increase the length of the muscle, it loses its ability to create force. So it cannot support your neck and head in the same way, and so it's going to strain and elicit pain. So I would massage that out, but here's the difference. What makes the Yass Method different from everything else. You go anywhere, they're going to tell you to do exercises for your neck. Look, do this, all stupid crap, right? Here's the thing. The levator scapula is only eliciting pain because the shoulder blade wasn't stabilized properly and it allowed the shoulder to move forward. So you don't treat the levator scapula here, I treat the muscles that stabilize the shoulder blade. And within a session, I can have you from here to here in one session.
Wow.
One session. And all of a sudden, gone. Pain, complete, resolved.
Amazing.
Now I give you videos on how to do this. You follow up and get the full strength you need.
Very cool. So one of the what we've been talking so much about is, like, I guess, biomechanical issues, right? Scoliosis and knee pain and so forth. But we have other conditions that can happen, right, due to, I guess, muscle issues. And what I'm trying to get at is your own story. I think I didn't ask you if it was okay to talk about this, but the picture you showed me in the beginning, is this because of imbalances, muscular imbalances?
Which picture is that? Oh, when I was...
The tumor. The tumor.
Oh, the tumor? Alright, so now, if we're going to talk about the tumor, then people have to understand that I found enlightenment 6 years ago, and as far as I'm concerned, I'm a servant to God. He has given me this understanding. That was not a human tumor. That was a God tumor. God put that tumor there, and it was because He wanted me to be prepared for what He is about to bring me, which is that people are going to have conscious awareness that the answer to resolving chronic pain has been given on earth through this method, and He needed me to promise that no matter how many people come in front of me, how many facilities need to be open, I must promise I will complete the mission as I am deemed. And I said yes, and then within 6 weeks the tumor was disappeared, gone. And nobody has an answer for it. The oncologist, no.
So you went to the doctor, it was diagnosed, the whole thing, and so the tumor, do you want to show the picture, or no?
I can show the picture. I was scheduled for, this is again why you don't accept diagnostic testing. They did a CAT scan, the tumor was covering my ear, they did a CAT scan, and they couldn't see the tragus part of the ear. That meant they thought that it was in my ear. So they weren't going to just take the tumor, they were going to be taking my ear. And the strange thing was, I always remembered it as starting here, but they didn't want to have any part of it. And so they were going to basically take the tumor and my ear. I'll show you.
Yeah. Yeah, the picture is intense, for sure. That's insane.
That is a squamous cell fungating carcinoma.
Wow. Amazing.
And then, just so everyone can see it, that's 6 weeks later.
Wow.
That's where it came through.
Yeah.
It was not in my ear.
In the ear, right.
And they were going to take my ear.
Uh-huh.
So I have a personal story about don't accept diagnostic testing because it's just an image. It's an interpretation of what is. It's not actually what is.
And so how long did it take for that to develop?
That's another thing. That went in there and they're like, why'd you wait a decade to get this treated? I was like, decade? This is 5 months. They said, that's not possible. I'm like, what are you talking about? I'm telling you. It exploded on my face.
Wow. And so all you said, so it was that moment, and so I'm just kind of making it clear in my own mind, but I just love it so much that in that moment that you said yes to God, it started to diminish.
The next day it was already starting to get smaller. 2 days before the surgery, I called up the oncologist and I said, something's going on. Something's changing. I don't know if I should get this surgery. So he said, come in, and he did another CAT scan, and he did the measurements, and his answers, exact words were, I really don't have an answer for you. It appears the blood supply to the tumor died. Don't get the surgery.
It appears to be.
They couldn't understand this. So they would laugh. They'd say, did you get radiation? Did you get chemotherapy? And I'd say no. And they'd say, well, what do you think it is? And I said, God. And they'd laugh.
Oh, of course. Yeah.
They don't, that's outside their parameter of understanding.
Yeah.
But
it's amazing.
It's undeniable to me.
Yeah.
I mean, you can clearly see that is a huge tumor, and within 6 weeks it was gone.
So fascinating.
Yeah, it's crazy. It's wild.
I'm going to ask you another question, but real quick first, I want to make sure that I get this in because we have a new sponsor who is Susan Drake Seidel. Sorry, I've known her for years as Susan Drake, and so is now Susan Drake Seidel. But she's with Mountain Medical Concepts, and she has some really cool products that she has available to practitioners, peptide therapy, stem cell therapy, all great things for pain. But, it's in addition to you're making sure that you're balanced. I mean, that might be the first thing that we do. We got to make sure we're balanced, right? So it's good to have options. But, she's got the, top of the line stem cell therapy, peptide therapy. So keep that in mind. I'm excited to have her on board as a sponsor. She's great at what she does and has great products. So I think I want to jump in now. I want to talk a little bit about, I think it's more about, when it comes to, I feel like sometimes people get my thoughts in line here. I'd have clients who do physical therapy, and they have physical therapy regimens that they do. I had one just yesterday said, so my regimen changed a little bit, and so I've got some new stuff to do. And so it's this ongoing forever. And yes, I think that these things are necessary. We need to have strength training. We need to make sure our muscles are in line. So I want to make sure that I'm understanding that what you're saying is we can change them quickly. We also then optimize by doing the exercises. Are these things in your mind lifelong, little exercises that we need to do? And how then do we make sure that the biomechanics stay in line? I mean, do we get rechecks? How does that work?
So first off, let me say, as a general principle, physical therapy is kind of worthless crap. I have a doctorate in physical therapy. It has no value. Understand the principle. Physical therapy says resolve pain and then strengthen. So they never anticipate that the force is actually muscular. That's the first thing you have to understand. Secondly, in a doctorate program, 7-year program, please show me weightlifting 101. It's not there.
Yeah.
So when you say you go to physical therapy, they hand you a sheet of paper and you'll do 25 exercises, and then there's just the real stupid stuff. So you have pain only on one side, but you're doing them on both sides. Well, if you have pain on one leg, by definition, if there's symptom, it means that's tissue in distress. So wouldn't you want to resolve the distress of just that leg and then get balance and then strengthen both legs? But by strengthening both legs, you have to understand your brain is always getting feedback. If you keep one leg stronger than the other, your brain will never allow you to weight bear on the weaker leg. And it will never get strong enough because you're not implementing it 50%.
Fascinating. Yeah, it makes total sense.
This is the real deal stuff.
Yeah,
This is physiology. This is very high level stuff I'm teaching you.
Yeah.
I'm telling you about. This is the stuff that I've come to know over my life's experience. This isn't from a curriculum. Okay?
Okay.
So then, of course, let's go to the idea with that person who has the knee pain around the kneecap, and we said their quad is too strong a relationship to their hamstring. You don't strengthen the quad. If you strengthen the quad, you're sustaining the imbalance, and that kneecap's only going to get tighter.
Yeah.
But they'll do everything. Quad, hamstring, every pull weighs around. And so you got to know which muscle is responsible for the symptom and only strengthen those muscles. Then you kind of have to have a almost weightlifting mindset, which is to say you have to understand the only way to make a muscle stronger is to implement progressive resistance, cause the muscle to adapt to greater resistances, thereby making the muscle adapt and get stronger. That's weightlifting. So if you come into my office here, so I have dumbbells up to 120 pounds, I have a leg press, knee extension, hamstring curl, donkey calf, I have a half rack to do squats straight like that. Now don't get big confused. That's not for like pro bodybuilders. That's not like for professional athletes. I'll have an 80-year-old lady come in here. I'm beating the crap out of her. She knows it. I know it. I make it clear to her. I'm going to challenge your muscles in a safe manner, but at its optimum, because you came here and you said you wanted to be pain-free fast. Well, I'm going to give that to you. And there's a lady who comes and she came in so unstable on one leg. If I blew on her, she would have fallen. She's been here twice. She is so much more stable now. Her pelvis is level again, which is going to give you 50-50 weight bearing, and that in itself will give you stability. So I don't care how old you are. I don't care what your story is. You come here, we make you strong.
Well, and I think that that's such an important point because, we have this mindset that as we age, we degenerate, and as we age, we have to be careful because we don't want to fall, because if we fall, we break something, and then, we're pushing toward our end, right? We're all going to have an end, but it doesn't have to be that way. And if we have this understanding that these small changes, therapies, whatever the case might be, that helps to bring stability can be a game changer in longevity. And I'm not a big fan of the term longevity because it really is more about the quality of life, not the quantity, right? But it's going to be a little bit of both, because if we break a hip, it's going to shorten our life, likely. Yeah.
Let me just give you, I'll give you one of the clearest differences between the Yass Method and anything else that's out there. So, you are older and you suddenly notice that you're more susceptible to falling, and someone tells you to get a cane, and then you're going to go for therapy, and they're going to tell you you have a balance issue. And so what they're going to do is they're going to have like a little tightrope, and they're going to try to make you walk on the tightrope, and they're going to try to treat your balance. Are you ready? This is the home run ball. Balance is not an entity unto itself. You can't fix balance. That's a lie. It's been a lie from its beginning.
Okay.
Balance is the culmination of two systems working synergistically. The semicircular canals of the ear, which are in 3 planes. So if I move here and I can measure the distance from those 3 planes, I can tell where I am in space. So my ability to know where I am in space comes from the semicircular canals. Then, if I go outside my base of support, I'm going to fall, so I need to be able to push myself back. So that's strength. Strength is the problem. So, we know there's 2 systems. How could I differentiate right off the bat that your problem is that you have a strength deficit, not the semicircular canals? I have you sit in a chair, I have you sit without your back touching anything, and I see, can you sit? Well, if you can sit, the semicircular canals know where you are in space, and so we know that's functioning properly. So your balance problem is a weakness problem. And so you have to know which muscles to strengthen, be aggressive with progressive resistance, And in strengthening the actual deficit, the person's quote-unquote balance is enhanced. So you don't train or fix balance. There's no such thing. You fix strength.
Yeah.
And I've taken people, I don't care, I've got people with Parkinson's who have been told, oh, that's causing their balance deficits. That's not even remotely possible. Parkinson's has something to do with synchronizing muscle movement so that it's coordinated. Now, the problem is, once they're diagnosed with that, what do you think that's going to happen with their loved ones? They're going to start getting scared. Oh my God, he may or she may fall. And what are they going to do? They're going to make them weight bear less. And when they weight bear less, what's that going to do? It's going to make them weaker.
Yeah.
And all of a sudden, you just incited that person to fall. I took a guy, full-blown Parkinson's, mask-like face, all of it. He strengthened him up. He was using a walker, I think. Nothing.
So, when you say nothing, like all of his Parkinson's symptoms disappeared?
No, I can't fix the Parkinson's symptoms.
Yeah.
I'm saying balance can never be a symptom of Parkinson's.
Gotcha.
It is not directly correlated. Parkinson's is specifically a part of the brain that has something to do with the coordination of muscle. So if I want to move my arm, you see how fluid I do that? If you had Parkinson's, it would be.
Okay. Yeah.
And then you get the mask-like face. But there's a general principle that has been created, that it affects balance. Parkinson's cannot affect the strength of any muscle. That's absolutely fallacy. It's just that those that love that person think they're doing the good thing for them by having them not move around as much, when in fact that's inciting a greater level of imbalance and potential for falling.
So I'm curious, maybe a little bit off topic, but as we're kind of on this, biomechanics and Parkinson's, have you noticed in your work any kind of added benefit of cognitive health when it comes to bringing muscles back into balance?
So now you're going to talk about something else. That's a factor that this has to do with my enlightenment, is that there are 3 planes that people live on, the physical, mental, and spiritual. And I have found that when people come in, I've treated hundreds of suicidal people. People that wanted to kill themselves, literally said, I'm putting a bullet in my head tomorrow if you don't fix this. I have succumbed to pain. I never had physical pain. I know more about physical pain than any one person, because I've treated thousands in it, hundreds who wanted to kill themselves. So as I found my enlightenment, I started to listen to the person more. And I would notice that they may start talking about an incident or a relationship with a person, and somehow that was connected to their pain. And so, like, I'll give you an example. A lady comes in, she has shoulder pain. She cannot raise her arm at all. Cannot raise her arm at all, 0. And she starts by saying, in 2 days, I'm having Thanksgiving dinner, and my mother's coming over. And if this isn't good, my mother's going to go crazy. And it's like a red flag.
Yeah.
She has connected her pain to this event and this relationship with a mother. So we end up fixing her shoulder pain, and we just sat down and I started saying, well, first off, enlightenment will tell you that nobody or nothing can hurt you. Only you can allow that to happen, and that's just fact. So I started talking to her, why does your mother bring up these feelings that clearly make you feel insignificant? And we ended up going through this process, and she started thinking about it, and eventually, about 2 months later, she had another event happening, and she just couldn't wait to tell me, oh my God, my mother's coming over, and it's so great, and I can't wait for her to see how great things are. Now, the question then becomes, which came first? Did taking away her physical pain allow her to clear her spiritual thing? Or was, as we were doing the spiritual thing, helping her not to have the pain there? And so my attitude is that I look at everyone as a whole, spiritual, emotional, and physical, and I try to make sure everything is clean and working optimally. So I believe very strongly in all of that.
Yeah. Cool. No, that's great, and I think it's so important, and it's a big piece that can be missed, but it's a big part of what I try to do as well, is look at all areas, because there's the mental and the emotional, the spiritual can have such an impact on the physical, and we just totally disregard that piece of it so often.
Yeah, it's so sad that does happen. So I try to give an example. A guy who just got back from Iraq or something like that, and he has PTSD, right? And he's been laying in bed, he just can't get up, and that guy's got back pain. I would suggest you not worry about his back pain. I'd suggest you worry about the PTSD and see if you can get that fixed before. Now, I take a baseball bat and I hit someone in the knee, and they're fighting with their spouse over some other silly thing, right? I'd probably treat the knee for the bat before I worry about that. So you gotta look at that person and understand them as a whole and try to figure out what is the primary trigger, what is leading all the symptoms, and try to, reach for that.
Yeah. So where are you located?
Jacksonville, Florida.
You're in Florida. Okay. Good to know, because people need to see you, and you are in the process of training other practitioners in your method, yes?
Correct. Yes, I think, God has said that be prepared, start preparing, because he's going to create conscious awareness. And I do see that happening. It's important for people also to understand that they could get this by Zoom. I've treated people in 15 countries. I just literally finished a lady for scoliosis who I did it through Zoom. And her husband, by the end of an hour and a half session, said, I haven't seen you stand like that in years.
So how do you do that through Zoom?
So I still can see the person, so I can still have them put their hands on their pelvis. She happened to have an x-ray, which was excellent, so I could clearly see where the scoliosis was.
Okay.
After 32 years of correlating symptoms and causes, I probably know what's wrong with someone in about 15 seconds.
Okay.
And so it's the only thing you don't get is the massage and the stretching, but the strengthening is the thing that's going to help in the long run, in the big picture. So as long as they get that, I mean, she was massively improved. She had back pain. She said it was better. It may have been gone by the end of that first session. So it can be done by Zoom. I just want to make one really quick point so people can really understand why this is so different.
Yeah.
Chronic pain never existed prior to the mid to late 1980s. Okay? Chronic pain never existed. Go back to the Greeks, the Romans, never. Mid to late 1980s, technology and automation develops, the microchip. Okay? As a result of that, automation starts taking over. And as a result, people get jobs in IT or social media. The teller is taken away. We have the ATM. And so as a result, large amounts of people are no longer doing weight-bearing multi-directional activity on a daily basis. They're sitting for 8 to 10 hours.
Right.
That's what leads to the weakness that develops. Right? Now, you have this massive, hundreds of millions of people entering the medical system with pain, acute pain, occurring at that time. The downside of it is that one of the technologies that developed is the MRI. By the way, it was designed to find tumors in the brain. It was not designed to, that's what it's designed for.
Oh, fascinating.
Find tumors in the brain.
Okay.
Yeah. So they got some secondary permanent thing.
Okay.
So that starts to find structural abnormalities when in fact it's evident that it's all muscular. Well, if you don't identify the cause as muscular and address it, if the muscles will continue to be in distress, elicit pain, and you go from acute to chronic pain. And that's what brought us where we are. So, if everybody's going to sustain this constant use of technology, be prepared that if you have pain, it's muscular. If you don't want to have pain, you're going to have to do isolated strength training.
Yeah.
Done.
Yeah.
Or go back and be a farmer. That's your choice.
Yeah. I mean, it's true. I'm in the middle of finishing up a book it's kind of talking about that as well to a degree, but it's, we're not intended to be like the intense biker that's all we do is bike or swim or weights or whatever the case is. We're intended to do lots of things to build muscle, to build stability, muscular stability, all of these things. you know, we're not one dimensional, right? It's all of the things that are so important.
Right.
So
in caveman time, we were supposed to do weight-bearing, multi-directional activity.
Yeah.
And that was great. There was no chronic pain until the mid-late 1980s when the microchip caused the computer to get so advanced that now, you know, probably 80% of the population doesn't even do weight-bearing activity anymore, whether it's job-related or even recreational. I mean, it's just silly.
It's terrible. It's terrible. I will say, for one, I'm going to call you, but the second thing is I realized when I started sitting a lot, because I didn't used to sit a lot, and this was years ago now, but I was having such intense pain in my neck. When I got a standing desk, it went away almost immediately.
Right.
It was amazing. And so there's so much to, for one, just being, having proper alignment, even when we have to do these things like being at the computer and all of these things, but then doing the strength training. I do a lot of strength training, but what I'm hearing from you is I need to be more strategic and more targeted, because I do still have some pain, which is why I'm going to call you, so I can be targeted and strategic in my
That's the biggest problem. People always say to me, I don't think I'm weak. I didn't say you were weak in comparison to anybody else.
Right.
I'm saying certain groups of your muscles are weak in comparison to other groups of your muscles, and that's why you have improper posture and symptoms.
Yeah.
That's
awesome.
all.
Awesome. Well, so good. Well, I'm super grateful for lots of reasons, for my own personal reasons, to have been able to chat with you, but I hope that a lot of people will really take this into consideration and give you a call. I'm excited that you're taking this method and you are spreading it out, because it is something that is much needed, for sure.
Yeah, I mean, I would just mention for anybody, the website's the yassmethod.com, and there is a blog page on there, and there are innumerable articles. I speak in lay people talk. There's never any fancy terminology. And the goal is quite simply, from head to toe, to give you the opportunity to understand what's creating your symptoms and understand the pathway to ending it, so you can get off this cycle of treatment and pain management and treatment. But you got to end it, man. It's not working.
Yeah. Very good. Well, thank you. Thank you so much for being here. I truly am grateful. I will say, I went to your website a couple of times, and it was super wonky for me. And I don't know if it didn't work properly, so it wasn't coming up. I don't know if it was my computer, but just to give you a heads up, check it out, because I'm not sure.
Yassmethod.com?
Yeah.
Maybe back when you did, I don't know how long ago. I mean, it's only been up a couple of months.
Oh, it was yesterday or today.
Yesterday, and it wasn't working?
Yeah.
Wow. I'll have to check that.
So just so you know.
Yeah, I'll take a look at it. I appreciate it. So I'm gonna reach out to you, but reach out to Mitch. I was gonna say Dr. Yass. My Texas comes out at me, and I just say Yass, you know. Yeah, that's okay.
But thank you, everybody, for joining us. This is such a great show, such good stuff. I'm super stoked myself. I hope that if any of you are struggling with chronic pain, that you will check out his website, check out his blogs, give him a call. I did not realize that Zoom was even an option, so that gets me just super wound up. So excited about that. Be sure, if you have interest in peptides, in stem cell therapy, that you reach out to Susan Drake. She is, again, she's a great resource, has great products for those who need those things. And of course, find us here, Taste Life Nutrition Radio and Podcast, streaming live every Thursday, 10 a.m. Mountain Time. You can go to the website, tastelifenutrition.com. I have an assessment you can fill out. We can chat about it and see if I can help, or if I know somebody like Mitch who might be able to help, who probably will be able to help. But that's the great thing, and why I love doing this so much, because I meet people who are doing such great things, and that's what we all want, is to be of service and to help people live their best lives. So let me know if there's anything that I can do to help with. And I want to make sure that I give a big fat shout out to our military. God bless all of you. Thank you. What a grateful, and that probably should have been what I'm grateful for, right? In the beginning is, this is Memorial Day weekend. We have some friends who are with us who are military friends. We have family. My heart is so big because of all that we have because of our military. So thank you for that. And with that, we're going to the mountains and going to have some fun this weekend. So I'm super excited about that.
That's great.
All right, wonderful. I will talk to you, or I'm going to reach out to you probably next week after I get back. But thank you again so much for being here, and we'll see you.
My pleasure. Thanks for having me.
All right.
Anytime I can spread the word, I appreciate it.
That's perfect. All right, take care. Thanks.
Thanks.
Bye.
Bye.